MRI Checklist for a remedy model 1001, 1100, and 1600. How to confirm a patient's device is eligible for an MRI scan for remedy model 1001, 1100, and 1600. Before a patient undergoes an MRI scan, it is crucial to complete the MRI scan patient checklist to ensure that the remedy system meets all requirements for the scan. This checklist will be provided to the MRI facility by the patient prior to the scan. The checklist includes 2 pages. Page 1 is divided into 3 sections. Part A, checklist for the pre-MRI check. Part B, healthcare provider's acknowledgement of MRI scan readiness of the remedy system. Part C, post-MRI check. Page 2 consists of 2 tables. Table 1 reviews the remedy system components eligible for a whole body MRI scan and head scan for a 1.5 Tesla and 3 Tesla. Table 2 provides information on off-the-shelf components eligible for whole body and head MRI scans. Information about remedy system components can be found under the patient information icon of an interrogated remedy system on the programmer. If unable to identify system components, please contact your local Respicardia representative. If the patient's remedy system is MRI eligible, proceed back to page 1. Start by filling the top section: patient's name, patient's date of birth, today's date, date of scheduled MRI, and the date of the clinic visit post-MRI check. Proceed to Part A, where all 9 questions must be answered yes for the patient's device to be MRI eligible. If any answer is no, the patient cannot proceed with the MRI scan, and please contact your local Respicardia representative if you have any questions. Questions 1 through 4 focus on ensuring the patient has the appropriate documents for the MRI scan and that the implanted remedy system components are eligible for an MRI scan. Questions 5 through 9 focus on ensuring the remedy device is set up for an MRI scan by performing a lead impedance test and turning therapy off. Please refer to the pre-post MRI device settings video for more details. All of Part A questions must be answered yes before proceeding to Part B. Part B requires a healthcare provider to acknowledge that the remedy system is ready for an MRI scan by confirming no abandoned RespiStim leads. All electrode impedances are within range and therapy has been turned off. The last section, Part C, confirms that a post-MRI clinic visit has been scheduled for the patient to turn on remedy therapy and restore the remedy device to pre-MRI settings. Please refer to the pre-post MRI device settings video for more information. Lastly, as previously mentioned, the patient will take this checklist to the MRI facility. If further assistance is needed, please contact your local Respicardia representative or refer to the Zoll Respicardia marketing document MKT3150 labeled MRI Frequently Asked Questions document. This video has reviewed the MRI pre-scan patient checklist.